A boil is a localized infection deep in the skin that generally starts as a reddened, tender area, becomes firm, hard, and eventually the center of the boil softens and becomes filled with infection-fighting white blood cells from the bloodstream.
Normally, everybody has bacteria growing on their skin. In fact, the mouth is one of the dirtiest places and urine is one of the most sterile. Sometimes during periods of low immunity and stress, what happens is the bacteria start multiplying excessively because our immune system does not keep them in check. Yeah? That is when we get boils.
There are different types of skin abscess. There is the furuncle that characteristically can have one or more openings on the skin and may be associated with a fever or chills. There is a cystic acne formed when oil ducts become clogged and infected, common on the face and typically said to occur in teenage years. And finally, the pilodenal cyst, a unique kind of abscess that occurs in the lower backside, making it difficult and uncomfortable to sit or move around.
Now, some people are prone to getting boils. Now, for them, what I would advise is you take an antiseptic bath. By an antiseptic bath, I mean a bath with a little bit of Dettol in it, or you can use Dettol soap. That will keep the bacteria in check. Another option is some people are actually carriers of the bacteria. Now, if you are a carrier of the bacteria, then what happens is you are constantly getting boils, recurrent. And sometimes the problem is that you have some bacteria in your nose, and that is the place where everything spreads from. For the nasal carriers, what I would advise is you get an antibiotic ointment and you apply it into the nares, into the nostrils on the inside, twice a day for around 14 days, and that normally gets rid of the carriage of the bacteria.
Most simple boils can be treated at home. Ideally, the treatment should begin as soon as a boil is noticed, since early treatment may prevent later complications. The primary treatment for most boils is heat application, usually with hot soaks or packs. Heat application increases the circulation to the area and allows the body to better fight off the infection by bringing antibodies and white blood cells to the site of infection.